Welcome to the Clinical File with John Cordray.
I'm a licensed professional counselor, and this is my mental health analysis of the Michael Smith case. These are my speculations. Have you ever wondered what happens when someone with a long history of violent behavior seeks therapy, but then rejects the boundaries set by their counselor? This question points to a potential red flag in mental health, where unresolved anger or entitlement can lead to dangerous escalations. Rebecca White was a 44-year-old licensed mental health counselor in Orange County, Florida. She owned a private practice called Down to Earth Therapy Solutions, a practice where she provided individual, couple, and sex therapy. White had built her career around helping people, including those with troubled past. She believed in creating a safe, non-judgmental space for clients to walk through their issues. But on the evening of January 19, 2026, around 9 p.m., White was wrapping up a session with a male client in his 30s at her office on Lee Road. This client had been meeting with her for support, and the session was coming to a close. But then suddenly, Michael Smith, a 39-year-old former client of White's, entered the office without an appointment, and he demanded to speak with her right away. White told him to leave, and the current client began calling 911. And it's in that moment, Smith pulled out a knife and started attacking. He stabbed White multiple times, and when the client tried to intervene, Smith stabbed him over 10 times as well. White was rushed to the hospital, but she died from her injuries. The client underwent surgery and survived, though he remained in critical but stable condition. Smith fled the scene. The next morning on January 20th, deputies found Smith's body. His death was ruled an apparent suicide. From a psychological perspective, Smith's history raises questions about patterns of behavior that might indicate deeper issues. He had a prior conviction from 2003 when he was 17 years old. In West Palm Beach, Smith ambushed a woman at her home, held a knife to her neck, and forced her inside, bound her with zip ties, taped her face, and sexually assaulted her over several hours. The victim escaped by climbing out the window and getting help from a neighbor. DNA evidence linked Smith to the crime, and he was arrested at a nearby mall. He was convicted with armed burglary to an occupied residence with battery, armed sexual battery, and armed kidnapping. Smith served nearly 19 years in prison and was released in 2022. Upon his release, he was required to register as a sex offender. His parole conditions included mandatory psychological or psychiatric evaluations, specifically for individuals who have committed violent sexual offenses and show signs of violent antisocial personality disorder. This court-ordered evaluation suggests that even back then, there were concerns about his mental health and potential for ongoing risk. Someone with this background might struggle with impulse control or empathy deficits, which are common in cases involving antisocial traits. But remember, this is my speculation based on public records. It's not a formal assessment. But why would someone like Smith, who had sought therapy after prison, end up attacking his former counselor? This brings us to another red flag: the psychology of rejection in individuals with histories of control and violence. When Smith demanded to see White, and she set a boundary by asking him to leave, it may have triggered an intense reaction. In therapy, boundaries are essential for safety and progress, yet for some, being denied immediate access can feel like a profound rejection, escalating to aggression. We see this in patterns where past traumas or unmet needs lead to entitlement, where the person believes their demands must be met no matter what. Smith's criminal history involved using a knife to control and harm, much like the incident in 2026. The repetition of method could point to a fixed pattern in behavior, where violence becomes a go-to response in moments of perceived loss of power. Psychologically, this might relate to learned behaviors from early experiences or prison life. Though we don't have details on his childhood, we can just speculate. Without that information, I focus on his behavioral clues, a history of forcing entry and using weapons to dominate. After his release in 2022, Smith moved to Orlando in October of that year, according to records. He became a client of White's at some point during that time, though the exact duration or focus of their sessions isn't public. But we do know that White specialized in working with offenders, including those needing help with rehabilitation and change. Her approach was compassionate, aimed at helping clients move from survival to thriving. Friends and colleagues described her as kind and effective, someone who believed in people's potential for growth. One former coworker noted that White was particularly good at working with offenders, helping them make real changes. This dedication likely drew clients like Smith to her practice. But what happens when therapy ends and the client feels unresolved issues are still lingering? This is another mental health red flag, the risk of transference, where feelings from past relationships get projected onto the therapist. In Smith's case, if he viewed White as a figure of authority or support, her refusal to see him could have felt like abandonment. For individuals with antisocial tendencies, this might not lead to reflection, but retaliation. Again, this is my speculation, drawing from common patterns in psychological literature and client-therapist dynamics. The incident unfolded quickly. Smith entered the office building at 933 Lee Road, which housed multiple suites. Questions have arisen about how he gained access after hours, as the building security has been scrutinized by White's family. In a statement, they expressed heartbreak and anger, pointing to potential systematic failures in access control, surveillance, and overall safety. They wondered how such an event could occur in a professional setting. From a mental health angle, this highlights the broader impact, the psychological toll on families and communities when violence strikes in a place meant for healing. Therapists like White often work with high-risk clients, and while most sessions are safe, incidents like this underscore the need for protective measures. Smith's choice to attack not just White, but also the intervening client suggests a lack of inhibition. The client, trying to protect White and call for help, became a target. This escalation could indicate a state of rage where bystanders are seen as threats. Psychologically, this might tie to a dissociative traits or overwhelming emotions that override rational thought. In cases of violent offenders, we sometimes see this as a part of a broader impulsivity issue, where the person acts without considering the consequences. Smith's suicide the following day adds another layer here. This could be a red flag for underlying despair or the realization of irreversible actions. In mental health terms, suicide following a crime might stem from guilt, fear of recapture, or a culmination of untreated conditions. Given his parole requirement evaluation for antisocial personality, it's possible that co-occurring issues like depression or anxiety were present. White's practice, Down to Earth Therapy Solutions, was founded in 2022, the same year Smith was released. She had worked in the field since 2008, including roles as a family therapist and a behavioral health consultant for the Florida Department of Children and Families. Her website emphasized a judgment-free environment, which likely appealed to clients rebuilding their lives post-incarceration. Smith's 2003 crime involved prolonged control and assault, lasting over 3 hours. He tied the victim to a sink, left briefly, and then returned. This level of planning and persistence might suggest a calculated behavior rather than pure impulse. In my mental health analysis of this case, it could point to sadistic elements or power fantasies. Fast forward to 2026, and the attack on White was more immediate, but still involved a knife and forced confrontation. Comparing the two incidents, one might speculate on enduring traits that therapy didn't fully address. Perhaps Smith sought help for reintegration, but external stressors overwhelmed him. We don't know what led to the end of his therapy with White, but his return demanding a session implies unfinished business. This raises a question. How do unresolved therapeutic relationships contribute to risk? In mental health, proper termination of therapy is a key to prevent dependency or resentment. If a client feels cut off abruptly, it can foster negative emotions. White's client, who survived the attack, showed bravery in intervening. He was stabbed repeatedly, but managed to get help. Psychologically, this act of protection might stem from the bond formed in therapy, where clients connected to their counselor, or it could just be a good citizen trying to stop a crime. It also highlights victimology here, the ripple effects of violence on innocent parties. The client's recovery is likely to involve trauma processing, possibly PTSD symptoms like hypervigilance or flashbacks. As a counselor, I see this as a reminder of resilience, but also the long-term mental health needs after such events. Smith's registration as a sex offender came with restrictions and monitoring, yet he was able to approach White's office. This gap in oversight might contribute to feelings of isolation or frustration for offenders, potentially exacerbating mental health struggles. Reintegration after prison is challenging, with stigma and limited support. Smith's move to Orlando might have been an attempt to a fresh start, but without adequate coping skills, it could have backfired. Another red flag here is the intersection of criminal history and mental health access. Many offenders receive court-ordered therapy, but compliance and effectiveness vary. If Smith exhibited antisocial traits, building trust in therapy would be really hard. Antisocial personality disorder often involves manipulation, a lack of remorse, and repeated violations of others' rights. In my speculation, his crimes fit this pattern, from the 2003 assault to the 2026 stabbing. The use of a knife in both suggests a comfort with that weapon, perhaps tied to control. Psychologically, weapons can symbolize power for those feeling powerless. White's family statement called for answers on security. They grieved her as irreplaceable, highlighting her youth and dedication. This loss affects not just the family, but her clients and the mental health community at large. Therapists often face risk, especially those working with offenders. Statistics show low but real dangers, prompting discussions on safety protocols. From a psychological view, this case illustrates betrayal in a therapeutic alliance. Trust is foundational, yet when broken, it can lead to tragedy. Why did Smith target his former therapist specifically? Perhaps he blamed her for not fixing him, a common misconception in therapy. Clients sometimes expect quick solutions, but with mental health, work is gradual. If Smith had abandonment issues or attachment problems, White's boundary setting could have felt like rejection. This is another question here. How do attachment styles influence violent responses? Insecure attachments, often rooted in early life, can lead to extreme reactions when connections are threatened. The office building's replacement of doors after the incident shows a practical response, but psychologically, the community may experience collective trauma with increased anxiety around mental health spaces. White's approach to sex therapy and offender rehabilitation was progressive. She aimed to help clients thrive, not just survive. Her death is a stark contrast to her mission. In analyzing his motives here, Smith's demand for a session suggests a crisis point. Perhaps he was experiencing a mental health emergency, but instead of seeking appropriate help, he forced entry. This points to a poor distress tolerance, a key area in therapy. Individuals with low tolerance might resort to maladaptive behaviors under stress. Suicide following the act could indicate remorse or escape. In mental health, post-crime suicides sometimes reflect internal conflict. Smith's antisocial evaluation might not have captured comorbid conditions like mood disorders. The client's attempt to protect White adds a heroic element. His actions likely saved time for emergency response. Psychologically, survivors of such events often grapple with guilt or what-ifs. Therapy for him now will focus on the processing of that trauma. White's legacy as a helper endures through those she aided. Colleagues remembered her passion for change. This case prompts reflection on the why behind violence against healers. Perhaps Smith's long imprisonment left him ill-equipped for freedom. Re-entry programs address this, but gaps exist. Untreated trauma from his own life or prison could fuel aggression. What role does stigma play in preventing seeking help? Offenders like Smith face barriers, potentially leading to isolation. White's work bridged that, but tragically, it ended in this way. The investigation confirmed Smith's identity through evidence. No other suspects emerged. Smith's case shows how past patterns can predict future risk. Yet therapy aims to break those cycles, and when it doesn't, we examine why. Perhaps insufficient follow-up after termination, or external factors like job loss or relationships. We don't know Smith's post-therapy life, but accumulated stressors might have peaked that night. The psychology of a murder-suicide often involves desperation. Smith's actions fits this, ending with self-destruction. This could indicate a final act of control. Mental health indicators here include impulsivity, entitlement, and possible personality disorder traits. This case underscores therapy's rewards, but also the risk. As a counselor, I advocate for safety while helping. Her story reminds us of the human element in mental health. What pushes someone from seeking help to harming their helper? The final red flag ties to betrayal dynamics. In therapy, vulnerability is shared, but if misused, it turns deadly. Smith's attack betrayed that trust. Reflecting on this analysis, I explored the psychological undercurrents here. From a violent history to motive, it's about understanding the why from cases like this to inform better practices. This is a case that really hits home here. As a therapist, I see a lot of clients from various different backgrounds with different traumas and histories. And it's a stark reminder that our profession as therapists comes with risk. And we don't always know that. We want to help people. We want to be the ones that are there and support them. But we ultimately don't know what's going on inside of their mind. And in this case, ended it so tragically. Rebecca here, the therapist, she was a person who devoted her life to helping people. She had no idea that her former client would come in and do this. So tragic. So what did you think about this case? Were there any elements that stood out to you? If you want more mental health analysis of true crime stories like this one, be sure to subscribe for more. And if you found this case compelling, be sure to watch this next story. It will make you more aware of your surroundings. Thank you for joining me today. Until next time, stay curious, stay safe.